talking about women's preventive health. And mammograms are important for women between the ages of 50 and 74. The current guidelines recommend that women get a mammogram every 2 years. Some of the things that women face that are challenging are just fears about what the test entails, what the results will be. And I think it's really important as healthcare professionals to educate women on reducing anxiety and really telling them that the test is relatively painless, but it is definitely important to catch cancers early and allow for treatment if needed. Our 2015 target is 82%. Currently, our practices are at 79.2%, so definitely some room for improvement. You know, some of the strategies the practices can do is to batch their outreach or do a campaign during Breast Cancer Awareness Month, which falls every year in October, and just use the Wellcentive registry and point of care tools that we have to remind women when they come into the office or even when they call for an appointment that they're due for a mammogram.
For cervical cancer screening, the HADIS measure pertains to cytology, which is Pap test, and an HPV testing. So the guidelines from American Cancer Society, American Society for Colposcopy Cervical Cytology, as well as the US Preventive Task Force, all of them came up with these screening guidelines that between the age group of 30 to 65 years, women should have a Pap smear as well as HPV testing done together, which is called as a co-testing, if everything is negative. If the woman doesn't have an HPV, and then cytology or Pap smear can be done every 3 years. This is a very new guidelines now. The guidelines used to be every 3 years or annual Pap smears. So there's going to be a culture change. So I would say around 50% of the physicians are doing it. The rest 50% probably are still catching on to it.
Patients need to hear from healthcare providers the importance of screening and the importance of compliance in order for them to really improve their health.